the three main rewards that you get with a Medicare Advantage plan. So if you have a Medicare Advantage plan, or if you're considering getting one, pay attention because you're going to learn some things today. This is part 2 in a 2-part series. My first one was the 3 main risks with Medicare Advantage plan. So if you have not watched that, be sure to check that out as well. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in other states as well, which you will see at the end of this video. If today is your birthday, Satchel Paige said, how old would you be if you didn't know how old you are? So let's get into it. Let's look at the 3 main rewards of Medicare Advantage plans. You may have thought of some of these. You may have thought of none of these. The number 1 reward of a Medicare Advantage plan compared to original Medicare and any other type of secondary insurance is the fact that you have more managed care. So with more managed care with the Medicare Advantage plans, you're going to have access to clinical care teams. This can be very important, especially if you have a chronic condition like diabetes, kidney failure, congestive heart failure, COPD, where these people will work with you to help you to recover or to deal with your condition much better than what you would have if you were under original Medicare. Because when it comes to original Medicare and a Medicare supplement, you just pay a premium and that's it. They don't care about your overall healthcare outcome. As well, with the more managed care, you're going to get in-home nurse visits. Now, you don't need to have them. You can decline them. If you don't want somebody coming to your house, a nurse or a clinical care person checking in on you, you can certainly decline it. But I have found many of my members have found those things beneficial, and they have discovered things that maybe their provider didn't, or they missed at the hospital or the skilled nursing center. Also, when typically if you've had an inpatient stay or a skilled nursing stay, and a lot of the insurance companies will send a nurse out for follow-up to make sure that you are recovering okay and everything is going well so that you don't need to be readmitted. The next part about the more managed care is the new trend of what is called value-based care. And the idea of value-based care is to be more patient-centered. As well as with value-based care, it is more focused on preventative care. So that's why the insurance companies will call you or remind you that, hey, you need to get your flu shot. Have you had your cancer screening? Do you smoke? Do you want to participate with a smoking cessation program at no cost? Those are things that you can have access to when you have more managed care that you wouldn't have with original Medicare. And the idea is to produce better overall healthcare outcomes. A number of studies have been done, and they've determined that people that are on Medicare Advantage plan do, in fact, have better healthcare outcomes than those on original Medicare. And that is purely because you have people that are following up with you, making sure that you're okay, trying to prevent you from ended up needing hospital care or skilled nursing care. Also, a lot of times with Medicare Advantage, when you have more managed care, you're going to get richer benefits and hopefully also have some lower costs as well. Value-based care is becoming a very big thing. So what you're seeing with a lot of the large Medicare Advantage companies, they're actually either partnering with value-based care companies or they are outright starting their own. So Humana has an agency called CenterWell that they're expanding throughout the country that has doctors and services that Humana members can go to and possibly other members as well. And then you have CVS/Aetna has purchased Oak Street, which is a value-based care organization. And then Elevance/Anthem now has CareMore Health that offers value-based care. So that is the trend when it comes to Medicare Advantage. And that can be a very good thing for a Medicare Advantage member to have this value-based care. The number 2 reward of Medicare Advantage plans is long-term savings potential. Now, I may get some pushback on this, but when you compare Medicare Advantage with potentially lower premiums than a Medicare supplement, so if you have a Medicare supplement and your premium for a supplement plus a drug plan is $200 to $300 every single month, well, that's $2,400 to $3,600 every year, or $24,000 to $36,000 every 10 years. So with a Medicare Advantage plan, yes, you're going to likely have some co-payments and co-insurance, and your co-payments sometimes could get very high. But will your co-payments over a 10-year period be equal to what you would pay in premium? In my personal experience, after 13 years and thousands of people, it's rare that I see that happen, but you need to examine it. You need to make sure that you're making a wise decision when it comes to choosing a Medicare Advantage plan. So with lower premiums compared to original Medicare over many years, even with potential for thousands in copayments, can result in substantial savings over time. But you must understand what your financial risk exposure will be. Financial risk exposure is what is the maximum that you could have to pay out of pocket. That's what you are exposed to. A lot of people don't think about that. You've got to understand your financial risk exposure. What are you potentially on the hook for, and are you prepared for it? And of course, even though there's potential for lots of premium savings, there's no guarantee you will. If you have some serious health issues over a span of 5 to 10 years and you're on a Medicare Advantage plan and you're paying lots of money out of pocket, it may not have been a wise choice. So you need to think about that. But that's where I come in. I ask the questions. We try to determine. We try to help you make a wise and confident decision again about all your options so you know what you're getting into. And then number 3 reward are all the extra benefits. Now, let me make one thing really clear. Do not ever choose a Medicare Advantage plan because of all the extra benefits. No doubt you have seen the ads on TV. Get this, get that, get this reward, get that reward. I have people call me up, do I get a grocery card? That is not why you choose a Medicare Advantage plan, but it is the number 3 reward of a Medicare Advantage plan. Let's take a look at the Medicare and You book when it talks about the extra benefits. It says here that with a Medicare Advantage plan, you may have coverage for things original Medicare doesn't cover, like fitness programs, vision, hearing, dental. Plans also can choose to cover more benefits. For example, some plans may offer coverage for services like transportation to doctor visits, over-the-counter drugs that Part D doesn't cover, and services that promote your health and wellness. So you need to compare the extra benefits, the bells and whistles. Again, never ever pick a plan based on the extra benefits. Find out how they work. The extra benefits are definitely nice. They can save you money, provide convenience, but that is not why you pick a Medicare Advantage plan. So that's it for today. The 3 main rewards of Medicare Advantage plan. More managed care, hopefully resulting in better healthcare outcomes, long-term savings potential, and the extra benefit. If you need help, if you have questions, please reach out to me. You can go to my website and learn more information there about Medicare and retirement insurance. There's a couple contact pages that you can connect with me as well. The states that I am currently licensed in. So if you live in one of these states and you need help, by all means, please reach out to me. Virginia, North Carolina, South Carolina, Florida, Tennessee, and now Texas. So if you live in Texas, I can help you. I'm now a licensed agent in Texas. If you happen to live near the Charlottesville, Virginia area and you would like to meet in person, which is a great way to meet, please reach out to me and we can probably arrange that as well. Please remember to like, subscribe, and who do you know that can benefit from this video? Please share it with them. I would greatly appreciate it. Again, my name is Chris Prang. I'm the Medicare analyst. Make it a great day.